Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be your facilitator for today's session. We're going to be starting a 3-session program today with Dr. Elliot Sklar and Lucy Barylak. And this is Engaging Caregivers, a program for healthcare workers. And today, Elliot and Lucy are going to be talking about defining caregivers and recognizing their experiences. But before they get started, let me tell you just a little bit about Lucy and Elliot in case you have not been with them before. Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and clinics in Texas. She would also like you to know that she was a caregiver for her mother for about 10 years. Dr. Elliot Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. Welcome, Lucy and Elliot.
Thank you so much. Welcome, everyone, and especially welcome to Dorsey and to Monica. It's so nice to see familiar faces on our roster and names. So welcome, everyone, and thank you so much for joining us. Today is part 1 in a 3-part series, and we will be providing everyone with handouts, so you don't need to worry about writing everything down if you registered for our program today. Our learning objectives for today's session include describing family caregivers and their challenges, discussing their role in care planning, reviewing physical and mental health issues among caregivers. We're also going to discuss addiction, and of course, with every program in this series, we will identify resources. Today's resources will be specific to self-care. And if you are interested in receiving a certificate of attendance, you can email your contact information and a request to caregiverteleconnection@wellmed.net. So again, thank you all so much for joining us. We have so much to go through today. Caregiving in the U.S. is the name of a national study, actually, that's coordinated by the National Alliance for Caregiving and the AARP, and it's published every 5 years. So the last study came out in 2020, and at this point, here we are at the beginning of 2023. We're halfway through until the next report comes out. But the last report really did not reflect the impact of COVID. And I would be surprised if I didn't see changes in a lot of the trends and in the report in terms of the last data that we have. But I think what will remain consistent is that we will see an increased number in caregivers. Family caregivers actually now encompass more than 1 in 5 Americans. They also have a lot of health implications related to their role. And I expect to see a lot of things changing, as I said, because of the role that COVID has had and continues to have. The 2020 report found that the majority of caregivers were baby boomers. And we know, certainly, from programs that we've done here with the WellMed Charitable Foundation, that more younger adults are becoming caregivers, especially millennials. According to the last report, 61% of caregivers were women, with 39% of men. And we also know, of course, that there are financial inequities for caregivers, certainly. And this is especially true because of the inflation that we have seen since the last report was published as well. We know that the cost of care has gone up. And in addition, a majority of caregivers, according to the last report, had at least one financial impact as a result of their caregiving role. like being passed up for a promotion at work or needing to take more time off, for example. More than a quarter of family caregivers also said that they had difficulty coordinating care. Now we know that there is also, of course, a staffing shortage in long-term care, but that also trickles down into private in-home care too. And we know that a lot of our AAAs have been facing staffing shortages as well. So as a whole in our healthcare system right now, we have a shortage of healthcare workers, and that is certainly changing the realities for many caregivers. So to give you an idea of the impact that caregiving has upon the health and well-being of caregivers, about 1 in 10 reported that caregiving has caused their physical health to get worse. Caregivers also reported chronic conditions, including heart disease, cancer, diabetes, and arthritis, at nearly twice the rate of non-caregivers. Women providing care to a disabled or ill spouse are more likely to report a personal history of high blood pressure, diabetes, and cholesterol. And women who spend 9 or more hours a week caring for an ill or disabled spouse increase their risk of heart disease nearly twofold. What was especially, I think, significant in this last report that we'll talk more about during our program today is that nearly 3/4 of caregivers reported that they had not gone to the doctor as often as they should, and more than half had missed doctor appointments. Now, the key in these statistics is that they present a concern for healthcare workers as well, because if they're reliant upon family caregivers to participate in the delivery of care, that has implications. And as Lucy will talk about as well, something that we were discussing that led to this program is that healthcare education is very much patient-centered. And healthcare workers do still have an obligation to be supportive of the health of caregivers, certainly. And so that's a challenge because it's a bit dichotomous when you think about it. And this is really a theme that we're going to be discussing during the entire course of this series. And we certainly welcome you to provide your 2 cents. Now, what's also interesting is that caregiving and caregivers change over the course of time. And a lot of this has to do with trends happening in our society that we don't really think a lot about. There's a lot of data and statistics here on this slide. And as I said, we'll be providing a handout to people after our program today if you registered. So I'm not going to go through all the statistics and read them out from the slide. I think what's more significant here is that some people don't think about the fact that people right now in our midst are having children older in life, and they're having less children, which means that down the road, there will be less sharing of caregiving responsibilities. In reality, millennials today and Gen Xers should really be thinking about this and saving for long-term care. But this is a conversation we don't often have. And some other ways that social trends are impacting upon caregiving, more older adults these days are divorced than generations before. And more older women are living alone and aging alone and living longer. According to the last report, 55% of women 85 and older were living alone. Now, our life expectancy as a whole went down since COVID, but when you remove the factor of COVID, more people are still living longer and needing more nursing home care, which is expected to keep growing through the year 2030. And my suspicion is that the next Caregiving in America report that comes out in 2025 will reflect some different trends and the fact that people are still living longer and we need more care, especially because we have a shortage in the workforce. So without further
her
ado,
ears and her voice and her eyes because she didn't speak English or couldn't read English. But things got very difficult when she needed a lot more care. And she started to have an awful lot of medical problems. She was diagnosed with diabetes. She had heart condition. She had arthritis. She had a stroke. And then she even had some cognitive impairment. I really found myself at that point becoming a hands-on caregiver. But I was working full-time in the healthcare profession. I was married at the time and had 2 children, and kind of my life kind of got out of whack, really, because I was trying to juggle everything. Even though I was a professional and knew a lot about caregiving issues, there was a tremendous denial on my part. And I think a lot of caregivers do have denial. I didn't really want to accept the fact that my mom could not do what she used to do before. And it's really quite a big transition to finally recognize, you know what, I'm not just a daughter, I'm her caregiver. I have to be there for her. The burden of caregiving is tremendous, and if you don't see the light at the end of the tunnel, it can become very, very stressful. I realized that I needed time for myself. I needed respite. Most of the time I was thinking about her needs, but then I recognized that I had my own needs. And if I wasn't able to sort of step away from the situation, I would be overwhelmed and burned out very quickly. Caregivers feel a lot of sadness, and you can understand why, because they're caring for someone that they loved. And all of a sudden that person is no longer the person that they knew before. Most of them feel the fact that they can't be there all the time to support their family member makes them feel very guilty. And just to see the person that you care for so much going through such difficult times, it's sad, it's depressing, and it's very hard to get over that. But it's important to allow yourself to at least acknowledge it and realize where it's coming from. You kind of need to get some control over that. It's very important to be able to ask for help, first of all. There is a lot of help out there, and to seek it out, whether it's going to a support group, whether it's going individual counseling. But one of the most important things also is having the education to understand the disease that your family member is going through, the stages and what to expect, so that you can actually look at your short-term goals, long-term goals, and how to handle them, so that you don't feel, oh my God, I don't know what's going on, and really feel literally empowered. By getting that information, it is a positive way of handling a situation like that.
My apologies that there wasn't a formal intro to the video, but Lucy, it's such an articulate discussion that you have.
Well, I guess what I was sharing there was my own experience, and I also see how blonde I really was then, huh? I'm just wondering, are there any comments or any questions that any of you have of me being a caregiver?
The chat box is open. If you want to write a comment, a question, a concern, you can do that in the chat box. You can raise your hand, unmute your microphone, or if you've dialed in, press *6 on your phone and that will unmute it.
Okay, it's something to think about. I'm sure that a lot of caregivers could identify with what I was saying. What I really want to do right now is to look at, we did a very big, large research study. Are caregivers a resource, a partner, or a client? Okay. It has been largely demonstrated through research and working in the field that without the support of family and friends, the majority are mainly women, it would be impossible to maintain people with major disabilities in the community. We know that family caregivers pay an important price at all levels for their involvement in providing care. But as Elliot said before, most of the models of care and service delivery regard caregivers as a resource for maintaining frail elderly or those with any form of dementia at home. Some healthcare providers feel that caregivers should be performing those duties, regardless of how many tasks are involved in the care. As well, many perceive that it's the family's duty to provide care. There's also an expectation at times to develop skills and knowledge in nursing, rehabilitation treatments, and equipment maintenance. Many caregivers themselves don't see themselves as caregivers, but only as a wife, a husband, a partner, a child, etc. In order to support and make sure that caregivers care for themselves, healthcare workers are the key in providing identifying, and advocating for caregivers' rights. Caregivers need to maintain their own well-being in order to care for their loved ones or to care for themselves. So let's go back to the question that I asked. Are caregivers a resource, a partner, or a client? And I want to tell you that this research took place in a home care setting, in a community setting, where there were a lot of healthcare workers, whether they were nurses, social workers, rehab team, help at home, AFSs as we call them. And so the study took place, and these were the thoughts of a lot of what healthcare workers. Now, just keep in mind, as Elliot said, there aren't a lot of healthcare workers in the profession right now, and there is those limitations. So the questions is, let's look at what is a resource, what is a partner, and what is a client. So a resource provides the right resources at the right time. That's what it means, basically. A partnership is an arrangement where parties agree to cooperate and advance their mutual interests, being equal in decision-making. And a client is a person who needs services. So let's go back to, are caregivers a resource? Is it right to expect caregivers to be a resource? I think we have to question ourselves. In certain circumstances, and if caregiver is able and willing to perform certain daily tasks, then yes. However, when the caregiver cannot because of their own limitations, age, or unwillingness, then whose responsibility is it? I think that we all need to look into our own value system, our cultural background, and answer those questions for ourselves. For example, do we expect a daughter who's capable to perform certain nursing tasks for her mother, like learning how to give insulin shots? I want to tell you my own story. You know, my mother had many, many difficulties. She also had some cognitive impairment, and she developed diabetes, and she needed insulin shots. And I remember being asked by the nurse to come to my mother's house, and she was going to teach me how to give my mother those shots. First, I want to tell you, I'm petrified of needles, okay? They really make me very uncomfortable. The thought of giving my mother an insulin shot put me in a state of anxiety. At that time also, I was working full-time, had young kids at home, and the time frame was not suitable for me in the middle of the day. And I basically told the nurse no, that I couldn't do it. I saw the way she looked at me. She was judging me. Here I was, a daughter, fairly appeared to be capable. Why was I not? But she never asked me why. So I think we really have to keep those thoughts in mind, that if a caregiver is not willing, there has to be a question, why is it? And it could be realistic. So I guess what I would like to ask you, and I hope that you participate, is what are your thoughts about caregivers as a resource? We know that they're doing it, but what are your personal thoughts about it? Do you think our expectations are too great?
Once again, the chat box is open, or unmute your microphone if you're on your phone. Darcy, I see that you had a question or a comment.
I share the same sentiments that you do, Miss Lucy, because the lady, my mother was in hospice, unfortunately, and they assumed that because of my level of education, my background, my affiliation with the medical field, you know, which was psychiatry, and not, you know, we learned, you know, physical, but I'm on the mental health part of it, not that, but we learn, and she assumed that I could use a needle. And as you stated, I'm petrified of a needle. I just can't. The only thing I can do is take alcohol and swab the area. That's it. That's all I feel comfortable with. And I could tell she was in her mind with her eyes. She was basically saying she can't even do that. And I was like, in my mouth, out of my mouth, no, I can't do that. Would I like to have been able to do that? Definitely, that's my mother, but I just couldn't. So, but I do think we are resources, but I'm not all. I wasn't all to my mother. There's no way I could have been.
Yeah, so we have to be careful as healthcare workers that we are not judgmental, that there might be reasons behind all that. Thank you for that. Thank you for sharing. Kind of validates me as well. I see that there's some things on the chat. I don't know if somebody could sort of help me with
Yes.
that.
Mayra shared, I have heard from many caregivers who are nurses that they were not prepared to take care of someone with Alzheimer's. Their training had not been sufficient. That's an excellent point. Dee shared, I think a resource, as in the definition, providing important information about the client so person-centered care can be provided, not providing personal care. And hang on, I'm going to scroll up. And as you explained, it depends on the individual caregiver.
Absolutely. For some caregivers, if they're able to and willing to and want to, by all means, why not? Even if they want to be educated about certain nursing tasks or certain rehab, for sure, as long as they're safe, as long as if they're being trained the right way. But there's other legal implications that I'm not going to get into right now, but I think we have to be very careful when we expect caregivers to do tasks that are professional and people that go to school to do certain tasks. I see somebody with their hands raised.
Monica will have something that you'd like to share.
Hi, thank you. I think the part that gets me most, and I am a clinical social worker who's been in this field for decades, is the fact that caregivers, family caregivers, can make or break a care plan. So the fact that they're not considered a crucial team member, with parity along with the doctors and nurses and everyone else, my goodness, the work that we do can undermine everything that they've done. And we know what runs healthcare these days, value-based care and good outcomes and everything else. They're dependent on us. And I think it's time where we own our status as really crucial team members.
Absolutely. And that leads me right into the next question. Are caregivers a partner? Okay. So if so, what does partnership actually mean? Being equal in decision making, the important thing to keep in mind is that the caregiver knows that their loved one better than anybody else, but they also know their limitations. So it's important in a partnership to ask what the person needs or what they feel they can do and manage. Negotiation is the key factor in any partnership relationship. So for example, are caregivers invited to meetings when certain decisions are made about service provisions? Are they included in these team meetings? Are caregivers asked, are they able to provide that service? So I think when we talk about partnership, it's so important. Now, it also depends on the organization, the establishment that you work in. But that's part of your advocacy for caregivers. Decisions should not be made only by the healthcare workers. Decisions need to be made with the caregiver provider. And in many cases, with the person that the service is given to, if they are in a position to be engaged in making those decisions. So we have to be extremely, extremely cautious about that. So the other question is, can anyone give us an example of how you negotiated with a caregiver in providing care for their loved one? Can you think of any one situation where you would like to share with us as a learning experience for all of us?
We'd love to hear from you and love to hear what your experience is. So feel free to unmute your phone or enter something in the chat box or unmute your microphone.
Well, while you're thinking about it, I'll share an experience that I had in my very, very early years of being a frontline social worker, going back a long time ago. We used to have clinical meetings, reviews of cases, obviously. And I was very adamant that I would like the caregiver to be part of that meeting. And I was shocked to see the resistance by the healthcare workers of not wanting to have that. And I couldn't understand why. There were certain issues, yes, certain things that should not be part of a discussion when it's not necessary for the person to be part of it. But I was just very curious to know, there seemed to almost be kind of a bit of a threat. The thing is that we have to expand our way of looking at services. We really have to be able to have the ability, if not to invite the caregivers to meetings, but to make sure that they're part of the discussions. So the next thing is our caregivers' potential clients. All right, so let's look at that. Since we know that caregivers are at risk for burnout, depression, physical and mental disorders, we need to be mindful that they may need help as well. Being a client means that they hopefully will receive support, possible services when needed, and the expectations that they are associated with caregiving will be somewhat diminished from them, that our expectations are not as high if they're a client. As a client, they also are given permission to care for themselves. Now, for example, if they need emotional support, is it available to them? What if they're no longer able to care for the person? How do you support them in looking into possibly transitioning that individual into a home care setting? So guess what I'm trying to say is it's also very clinical in a way. We were very adamant that we wanted to open files on caregivers so that they do have a place as being a client. I would really be interested to hear what you think about the whole idea. Should we be looking at a preventive method, really, because it's prevention we're talking about, of looking at caregivers as clients? It's a controversial question, but think about it for a moment and tell me, what are your thoughts on that?
Yes, Monica.
I don't think it's controversial, because I think that what the healthcare professionals see at that moment or during that stay is different than what happens over the course of a day, a year, or the personality of the person you're caring for. So I think that the caregivers offer such important insights. I mean, my mother may say, oh, of course I'll do that. Of course I'll change my diet. Of course I'll give up the candy bars. She's not going to. I mean, you know what I mean? There's some very practical things when it comes to really understanding the environment and the person that you're caring for. And I just think that that we need to, I'll go back to my soapbox. We need to demand our position within the care team.
Yes, that's part of advocacy for yourself and
Right.
for the person you're caring for. I
Right.
saw something on the chat box.
Yes, Dee wrote, I've heard caregivers referred to as the invisible patient.
Interesting. Very, very interesting to look at that. Yes, I mean, maybe this is food for thought, and maybe a lot of us haven't even thought about it. We just assume that caregivers play a role, which they do, but more as a resource rather than possibly being a partner or being a client. Just before we move on, I think there was something else on the chat, or?
Yes, Julia said, I had to teach my sister, who is ex-military, to care for our mother, who resented her for not being part of her life when she was well. So I used the home health RN myself and called a conference of all 4 siblings that there is very limited health care due to COVID. I'm a retired RN, so I was able to have biweekly conferences with my mother included. It was a task, but well worth it in the long run. It makes a difference when the team is all on one, I think, accord. And Beth shared, it was very difficult to remove myself from so many of my loved ones' care and care for myself, as I was the medical power of attorney for all. Saw a lack of concern from some medical professionals, and felt such responsibility and loyalty to my family members versus myself and my reprieve from their care and my own declining health, helping them all die. Mara shared the dementia person may be in denial or confabulation, so we need the caregiver input. And Beth shared, unfortunately, this all began when my first patient was my 4-year-old little boy who was dying of cancer. The pattern began there.
Mm.
And Mara shared, a dementia person may be in, oh, sorry, it was a duplicate message.
Well, I
Thank you
wanna-
all.
Yeah, thank you so much, all of you. You know, your thoughts by sharing means so much to everyone who's listening. Thank you.
Glenda, I wasn't sure if you had a comment.
No, I was reading all of these as you were saying them, and it just touches me, so much about where our family caregivers and professional caregivers are coming from. I'm so grateful that they shared their messages with us.
Absolutely. And, I certainly would consider myself to be standing with you, Monica, on your soapbox, because I definitely agree with a lot of the things that you've shared. What's interesting to me as a healthcare educator is that this is a controversial topic among my colleagues and my students, all of whom agree upon the importance of the role of caregivers. But the concern is that our medical school curriculum, our nursing curriculum, our physician associate curriculum, they're all so tight that it's hard to include additional content areas. So how do you switch gears and focus on a caregiver and not the patient themselves? And the same holds true for a lot of insurance in terms of the practicality of things. But in reality, we know that when one person in a family is unwell, the whole family can be unwell. And I think it's a very important thing for us to sort of take pause and to consider, because never in any curriculum have I ever seen this addressed. Are caregivers a resource, a partner, or a client? And what does that mean? Something also very interesting that I thought about as I was teaching a doctoral institute this past winter, just a few weeks ago, is that I teach conflict resolution in healthcare, which is something that almost all of our health profession students receive nowadays, because conflict within our healthcare settings occurs. What's very interesting is that if you look at the lens of conflict resolution and mediation, is that we teach students that healthcare is patient-focused, with caregivers as being secondary. But if we look here at how primary parties are defined and secondary parties, where do you see the role of caregivers? Now, I share this because it's such an interesting lens for me that really reaffirms that caregivers are primary. They're front and center when it comes to the health of a patient. And we all really need to shift our thinking about how we view care and the role that people play in providing it. Now, with that said, self-care among caregivers, I think, becomes all the more critical. And it's something that we all need to practice more of. We all hear it all the time, especially around New Year's and New Year's resolutions. But we all know that somehow we don't practice what we preach. So I think this is also especially true for healthcare workers. If you think about it, there's a reason that we are in the helping professions. And when we embark upon those careers whose focus is to care for others, sometimes we lose sight of the fact that we need to do that for ourselves. So I want to talk a little bit about some family caregiver health concerns, because research shows a lot about the effects of caregiving on health and well-being. As an example, research has found that if you're a caregiving spouse between the ages of 66 and 96 and are experiencing mental or emotional strain, you have a risk of dying that is 63% higher than that of people in the same age bracket who are not caregivers. This study found that the combination of loss, prolonged stress, and the physical demands of caregiving also, along with the biological vulnerabilities that come with aging, put people at significant risk for health problems and an earlier death. Now, that's a very horrifying statistic, but it's something that a lot of caregivers think about because they experience health issues. It's hard not to pay attention to that. And older caregivers are not the only ones that put their health and well-being at risk. If you're a baby boomer who has assumed the role of caregiving for your parents while also juggling work and raising children, you may have faced an increased risk for depression, chronic illness, and a possible decline in quality of life. So despite these risks, however, family caregivers of any age are, as I mentioned, less likely to practice preventative healthcare and self-care behavior. And that is true regardless of age, race, sex, gender, ethnicity. Caregivers talk a lot about not being able to attend to their own health and well-being while managing caregiving responsibilities. And as such, they often report poor sleep, poor eating habits, not making time to exercise, not staying in bed when you're sick or resting. And as I mentioned before, postponement or failure to make normal routine medical appointments. So it's very important, I think, that we consider all these things as healthcare workers, especially when we're working with people who are caregivers in the midst of our direct patient care. And the question is really, how do we then refer them? Are they a resource? Are they a client, as we discussed? And they might very well be. So I think it's just an important thing that we think about, because if you think about as well the oaths, the professional oaths that many of us take, they are to provide care. And if we see that we're in a household where someone who is a caregiver doesn't seem well, then I think it is something that is certainly worthy of addressing, just as it is among ourselves as healthcare workers. So I want to ask everyone a question that usually stumps everyone, but what do you need today to feel taken care of? It's an excellent question because many of us don't think about that at all.
Well, that's a good one. Good one, Elliot. We'd love to hear from you. Dorsey, you have a response.
Someone to just listen to me,
Yeah.
just listen.
That's
Yeah.
such a great point. That's such a great point. And that's why we're here. What do you want to tell us?
Oh, I can't do that.
Well, this is a good reminder that we now have an amazing resource, 811, or wait, I'm sorry, it's 988. Hang on. I keep forgetting we have so many different resources, but there's a new mental health hotline, and it is completely free. And yes, it is 988, and it is a 24/7 help and crisis line. You can also text that number and someone will respond to you.
You know, at the end of the day, I see someone said that just to you said to listen, to be compassionate. There was a few other words like
That
that.
their concerns and emotions are validated. Sometimes they need a vacation or a break from caretaking, knowing someone else can do it while I am gone.
Well, that goes back again as healthcare workers to ask a basic question that was very rarely asked of me. How are you doing? Very, very basic. And
Yeah,
give people the opportunity to say, well, either I'm doing okay, I'm managing, or I'm not. And giving them the opportunity. So even though they might not be your client, you're giving them the opportunity at that point to listen to them. And I think it's so important to always remember, and I'm sure a lot of us are doing it, is to ask, and how are you today? And what's happening in your life?
I'm sensitive to our time and I love all of this wonderful participation. One quick tip that I do want to share. I believe strongly in the power of physical activity, and I've shared a lot about my recent discovery of Pilates and how much I enjoy taking classes on a reformer Pilates carriage. What I came to learn is that a number of the older women that are in my Pilates studio, and I'm one of the few people I would say who are under 50, one of the very few men, is that a majority of them are caregivers for a spouse. And taking the Pilates class is the 1 hour of the day when they do get respite for their loved one, leave the house and do something good for themselves. And though we can't always take a vacation, as one of our participants said that they felt that they needed, I love that concept of having an hour break to look forward to and to doing something good for yourself. So self-care, super important. If you are a healthcare worker, ask others and ask people in your household, what do you need today to feel taken care of? It's such a great question, and we never really think about it. It's a question, actually, I try to ask myself every morning when I'm having coffee. And it reminds me that I need to fit something into my day that's just for me. And it could be just sitting outside for 15 minutes, but it's very important. So we need to also remember that self-care is not selfish. This applies for ourselves and certainly for family caregivers. Many times, I think attitudes and beliefs form personal barriers that stand in the way of not taking care of ourselves. These may be lifelong patterns. And like I said, I think that for healthcare workers, our profession focuses us on taking care of others, not ourselves. So for some of you, this might sound very familiar, but it's very important to break old patterns and overcome obstacles. And that's not an easy proposition, but it can be done. And the first task is to remove those personal barriers in the way of you taking self-care. For example, do you think that self-care is selfish? Does it frighten you to think about your own needs? It frightens me to think about my own needs. I think it's more common than people recognize. And then you have to sort of question, what is that fear about? For me, I have a very hard time asking for what it is that I need, and that's part of that fear. And where does that come from then? Do I feel inadequate because I need to ask for help? Do I do too much as a result of that? I'm sure that many people participating can resonate with some of those thoughts and some of those feelings. And I think that sometimes caregivers have misconceptions that increase their stress and get in the way of good self-care. Because we base our behavior on our thoughts and our beliefs, attitudes and misconceptions like the ones that I've discussed can, really cause caregivers to try to do what can't be done and to control what can't be controlled. And the result is feelings of frustration and failure and an inclination then to feel like you're not deserving of having your self-care needs met. So I think it's really important that we all think about that and remember that self-care is a very important part of the job of a healthcare worker. I say it all the time, but when we don't care for ourselves and when we spread ourselves thin, we're like one-ply toilet paper, uncomfortable, don't make anyone happy, and don't do the job very well, right? So, it's something that I think has always made people laugh over my decade plus when I share that analogy, but I think it makes a lot of sense. No one likes one ply. So try to buffer yourself and remember that self-care is super important.
Wow, that's a lot to take in. I'm also looking at the time. So I think this is important, though, for all healthcare workers, that the impact of caregiving on caregivers' mental and emotional health, and I'm sure that you've heard about that many times, that 16% of caregivers feel emotionally strained and 26% say taking care of care recipient is hard for them to manage. So there's but an estimated between 40 to 70% of caregivers have clinically significant symptoms of depression, with approximately 1/4 to 1/2 of these caregivers meeting the diagnostic criteria for major depression. Okay, it's not a situational thing. They are depressed, and it is a mental health issue. So it's really, really important to keep that in mind. And also that, there's both caregiver depression, perceived burden increase as the care recipient functional status declines. So you're going to get a lot of these slides so you can go over them a little bit more. Now, depressed caregivers are more likely to have existing anxiety disorders, substance abuse, or dependence, and chronic disease. Depression is also one of the most common conditions associated with suicide attempts. So it's really, really important to keep that in mind and know the signs of what's going on. You know, caregivers suffer from high levels of stress and frustrations. So what does it really look like? So here are, so 16% of caregivers feel emotionally strained, and 26 say taking care, as I said before, is really, really extremely difficult. I'd like to talk a little bit about women caregivers. If we can go to slide 18, yeah. So research shows that female caregivers who, who are taking care of someone reported higher levels of depression and anxiety symptoms and lower levels of subjective well-being, life satisfaction, and physical health than the male caregivers. According to one study, there is a dramatic increase in the risk of mental health consequences among women. In a national survey on caregiving health, more than 1 in 5, that's 21% of women surveyed, had mammograms less often. So what it's telling us is that women caregivers do not take care of themselves. Stressful caregiving situation may lead to harmful behavior. As a response to increased stress, caregivers are shown to have increased alcohol and other substance use. Several studies have shown that caregivers use prescription and psychopathic drugs more than non-caregivers. Family caregivers are at a higher risk for higher levels of hostility than non-caregivers. Spousal caregivers who are at risk of clinical depression and are caring for a spouse with significant cognitive impairment or physical care needs are more likely to engage in harmful behavior toward their loved one. So what we're talking about here is the whole idea of elder abuse, which we are going to speak about next session, not only elder abuse towards the care receiver, but the other way around. So I guess what I'm trying to say is that we have to be very, very cognizant and look at all the situation, what's going on with that caregiver. So family caregivers have increased risk and excess use of alcohol, tobacco, and other drugs. Caregivers could be, it can be an emotional roller coaster ride, right? And as healthcare workers, it's very important to be aware that caregivers and their loved ones may be suffering from any form of addiction, okay? In the past, so what is addiction? Let's look at that for quickly, just to see. Addiction is a disease. We have to be really to look at it in that perspective. Over time, addiction can physically change a person's brain, the way they behave and they act, and even aspects of their personality. The disease of addiction must be treated like you would treat diseases or any other illness, and involves a treatment plan and good support system. All right, so we have to also be aware. So let's look at what are the signs of addiction. All right, so let's look at that. So it could be lack of control, decreased socialization, withdrawal, change in sleeping, chronic fatigue, constant illness, injuries, physical changes, bad skin, hair, teeth, nails, things change. They could even have memory loss, obviously depression, aggressive behavior, apathy, and more. I do want to say that when we look at addiction, it's not just substance abuse. It includes drugs such as I said, alcohol, tobacco, cannabis, prescription medication. It could be shopping addiction. It could be gambling, cyber addiction. That's a big one with a lot of people nowadays. And sometimes even binge eating, sex, and others. So it's really important as a healthcare worker to familiarize yourself with the signs of addiction and to view it as a disease. So I'm just looking at the time and we're really getting right down to the bottom. So I'm just wondering if anybody has any questions, or Elliot, would you like to say a few words at this time?
Let's open it up to see if anyone has any last questions or comments. We have a large group today, and your comments have been both very touching, but also very on point, I think, for sharing with others your own experiences. I think they're very relatable. As we wait for people to think about their last comments, one thing that I did want to note is if you are a healthcare worker and you do find that a caregiver seems to be unwell, what do you do? And that's something that we're really going to explore a lot in our program next week. But one thing you can certainly do as your own certainly just to give yourself some peace of mind and reassurance is certainly to refer that caregiver to see their primary care physician, or even to go to a local minute clinic or a quick walk-in clinic as an example. But you can also, in your clinical notes for the patient for whom you are providing care, that care recipient, you can put in your notes that you have referred the caregiver to receive healthcare or mental health care. It's important that there is some documentation of your effort to refer. And again, that is something we're going to talk about more next week. We did something a little interesting this time. And if you'd like to register for our program next week, here on our slide, we have a hyperlink. And it's just under where it says 216. You can click on that and it will take you directly to register for our program. We do also have a number of resources as always to share, and these will be included in the handout if you registered for our program today. We have one comment here. Agree that that caregivers will self-medicate with food, alcohol, etc. Also, doctors do prescribe medication to calm stress, and sometimes this is necessary, but it does cause concern. It's an excellent point. And that's also why I love exercise. When I was in my 20s, I used to work out to look great. When I was in my 30s, I used to work out for my physical health and to be in better physical form. And now that I'm in my 40s, I work out for my mental health. So I really do see a difference, and I really believe in the power of working out, exercising, taking a walk in nature. It is tremendous to help with relief of stress. And with that, right on time, 11:55, 5 minutes left. I'm going to pass the torch over to you, Glenda, because I know that you have information to share.
Thank you so much. If you did register for the call today, and Elliot mentioned this, you will be receiving the materials that we have for you, including these resources and also including that hyperlink where you can go and register for the next session automatically. You can also go to the Caregiver Teleconnection website and look for this particular session, and you can also register there. But I do encourage you to register. If you don't, a lot of times you miss out on all these resources and materials that we send out later. Along in that email, you will also get a request for feedback, and we'd love to hear from you. We'd like to hear what you thought of the session, but we'd also like to hear if you have some ideas for topics for future sessions. Or maybe you've been to a conference about caregiving or some training and you heard a speaker that you think would be really good for others to hear. Let us know about that in that feedback form. It won't take you but a couple of minutes, and we would appreciate you participating in that. I wanted to let you know that the Caregiver Teleconnection calendar is really busy for the month of February. In addition to the next two sessions that Elliot and Lucy will be presenting, on Monday, February the 13th at noon, there's going to be an interesting session entitled Changing Isolation and Loneliness to Better Connections. And that's with Andy Crocker here in Texas, sponsored by the North Central Texas Caregiver Teleconnection. And those of you that work with caregivers, you understand how important it is to address isolation. It can happen just so easily, and people slide into depression as a result of that. And then I also wanted to tell you that on Tuesday, on Valentine's Day at 10 o'clock Central Time, there will be a Spanish language session. So if you're working with people that their primary language is Spanish, I would encourage you to let them know about this. It's challenges in the management of dementia and talking about key issues in that. And that's with Dr. Nestor Praderio. And if you've not heard from him before, I would encourage you to listen in if your primary language is Spanish. We have about 3 minutes left, and that's ample time for last minute comments, questions, concerns that you would like to share.
Well, while you're thinking, I'd like to tell all of you that frontline healthcare workers are the backbone of effective health system. And you play a tremendous big role in supporting clients, caregivers, just people in general. So I want to thank you, and please take care of yourselves, because I know we need to take care of ourselves. We need to be able to set limits, and we also need to be able to say no and not feel guilty about it.
Good point. Thank you all so much for joining and participating today, and for your input and feedback. And I certainly hope that you will join us next week for part 2 in this series. Hope everyone stays well and practices a moment of self-care today.
Thank
Take
you.
your own oxygen first. That's the key. Thank you for joining us today, and we hope to see you on future teleconnection sessions. Bye-bye.
Bye-bye.
Thank you so much. Bye-bye.